स्टूडेंट्स, आज हम एमएससी प्रीवियस के 4th यूनिट में एंटीमाइक्रोबियल एजेंट की स्टडी करेंगे। An antimicrobial is an agent that kills microorganisms or stops their growth। यानी एंटीमाइक्रोबियल एजेंट क्या होता है कि जितनी भी बैक्टीरिया या माइक्रो ऑर्गेनिज्म हैं उनकी ग्रोथ को स्टॉप करते हैं, रोकते हैं। जिससे क्या है, हम एग्जांपल लेते हैं कोई ड्रग का। Antimicrobial medicines can be grouped according to the microorganism they act primarily against. For example, antibiotics are used against bacterial and antifungal are used against antifungi. They can also be classified according to their functions. Agents that kill microbes are called microbial, while those that merely inhibit their growth are called biostatic। यानी एंटीमाइक्रोबियल जो एजेंट है, यदि माइक्रोब्स को किल करते हैं तो हम इसे माइक्रोबाइसिडियल कहेंगे। जबकि अगर वो उनकी ग्रोथ को रोकते हैं, हम उनको बायोस्टैटिक कहेंगे। द यूज ऑफ एंटीमाइक्रोबियल मेडिसिन्स टू ट्रीट इन्फेक्शन इज नॉन एज एंटीमाइक्रोबियल कीमोथेरेपी। While the use of antimicrobial medicines to prevent infection is known as antimicrobial prophylaxis, the main classes of antimicrobial agent are disinfectant, non-selective antimicrobials such as bleach, which kill a wide range of microbes on non-living surfaces to prevent the spread of illness, antiseptic, which are applied to living tissue and help reduce infections during surgery, and antibiotics, which destroy antimicroorganisms within the body. The antibiotic originally described only those formulation derived from living microorganisms, but is now also applied to synthetic antimicrobials such as sulfonamide or fluoroquinolones. The term also used to be restricted to antibacterials and is often used as a synonym for them by medical professionals and in medical literature. But its context has broadened to include all antimicrobials. Antibacterial agent can be further subdivided into bacterial agent which kill bacteria and bacteriostatic agent which slow down the stall bacterial growth. In response, further advancements in antimicrobial technologies have resulted in solutions that can go beyond simply inhibiting microbial growth. Salman Waxman, who was awarded for the Nobel Prize in Medicine for developing 22 antibiotics, most notably streptomycin. अब है केमिकल्स जो यूज आ रहे हैं एंटीबैक्टीरियल are used to treat bacterial infection. Antibiotics are generally classified as beta-lactam, macrolides, fluoroquinolones, tetracycline or aminoglycoside. Their classification within these categories depend on their antimicrobial spectra, pharmacodynamics and chemical composition. The drug toxicity to human and other animal from antibacterial is generally considered low. यानी डिपेंड्स करती है. Prolonged use of certain antibacterials can decrease the number of gut flora which may have a negative impact on health. Consumptions of probiotics and reasonable eating can help to replace destroyed gut flora. Stool transplants may be considered for patients who are having difficulty recovering from prolonged antibiotic treatment, as for recurrent Clostridium difficile infection. Since 1980, the introduction of new antibacterial agents for clinical use has declined in the part because of enormous expense of developing and testing new drugs. In parallel, there has been an alarming increase in antimicrobial resistance of bacteria, fungi, parasites and some viruses to multiply existing agents. Antibacterial are most commonly used drug and among the drug commonly misused by physicians. For example, in viral respiratory tract infection, as a consequence of widespread and injudicious use of antibacterials, there has been an accelerated emergence of antibiotic resistant pathogens, resulting in a serious threat to global public health. The resistance problem demands that a renewed effort be made to seek antibacterial agent effective against pathogenic bacteria. Resistance to current antibacterials. Possible strategies towards this objective include increased sampling from diverse environments and application of metagenomics to identify bioactive compounds produced by currently unknown and uncultured microorganisms, as well the development of small molecule libraries customized for bacterial targets.